Hi, welcome back to the Gluten Free RN podcast. I'm Nadine, and today during episode 23, we are going to talk about cardiac issues or heart issues associated with celiac disease. Stay tuned. Hi, welcome back to the Gluten Free RN podcast. Today, during episode 23, we are going to talk about cardiac issues associated with celiac disease. Cardiac meaning heart. So today we're going to talk all about your heart health and cardiac issues associated with eating gluten or non-celiac gluten sensitivity and celiac disease. This is a very important topic, because in March of 2014, it was released in a really nice article entitled Celiac Disease Linked to Almost Doubled Risk of CAD or Coronary Artery Disease. That's big news. And what we need to do is, number one, find all of the people that are suffering from celiac disease, but they don't know it, and also help prevent cardiac disease and strokes. We used to believe that heart attacks and strokes were caused by increased consumption of saturated fats. We no longer believe that's true. As a matter of fact, we haven't believed that was true for a long time. We know that heart attacks and strokes are caused by inflammation. The goal of preventative medicine is to prevent disease. So we really do need to be looking at anything that will decrease inflammation in our bodies. One of the key components of that is diet and exercise. And when we talk about diet and exercise, we absolutely have to talk about a gluten-free diet. Because if we don't, then we're missing a huge component in preventing heart disease and strokes. So let's talk more today about why this is so important and how much it overlaps. In my former life, I was an emergency trauma critical care nurse in emergency departments all over the state of Oregon. We saw a huge number of patients that would come in with chest pain or stroke symptoms, and our goal was to quickly and efficiently recognize them and treat them. But imagine if we could actually prevent those very catastrophic events from occurring. Some people actually didn't survive those cardiac events, or that acute MI, or that heart attack, or that stroke. And if they did survive, some of those people ended up with lifelong, debilitating injuries to their hearts or their brains. So ideally, what we're going to do is prevent those events from occurring. And if we know that celiac disease is linked to almost doubled risk of cardiac disease, then we really need to address that. We need to find the people that are undiagnosed with celiac disease and address those issues. There's a great number of research articles in PubMed that link celiac disease or non-celiac gluten sensitivity to heart disease and strokes. If you're looking for more information, please go to PubMed and put in whatever you're looking for and link it to celiac disease. You will get a plethora of information. And if you get a study that doesn't make any sense or you're having trouble interpreting it, you can contact me. It's fine. I love to discuss any of the research that has come out worldwide so that we can have a better understanding of how gluten and grains affect our health overall. Cardiomyopathy, which is profound heart failure, has been linked to celiac disease very extensively. There is a well-documented connection between eating grains and profound heart failure, or what we call cardiomyopathy. There's a great little story. When I started to do this and be the Gluten Free RN about 10 years ago, a lady came in and talked to me, and she wasn't a patient or a client of mine, but she did relate this great story of having had been diagnosed with cardiomyopathy by a cardiologist in our town, and she then adopted a gluten-free diet. She went on a gluten-free diet. I can't even remember if she had been diagnosed with celiac disease or not. But she had done some research and she had gone on a gluten-free diet, which, interestingly enough, had resolved her cardiomyopathy. She no longer had profound heart failure. Traditionally, what we do with people that have cardiomyopathy is we tell them that we can treat them, but we can't cure them. So medications are given, and then typically time passes and we wait for the damage to get so bad that we have to put them on a heart transplant list. These patients should all, number one, be tested for celiac disease, because if it is gluten that is causing the profound heart failure, and there's a great chance that if they adopt a gluten-free diet, they will no longer have profound heart failure, that option has to be offered to people. They have to know that there is a potential cure for their cardiomyopathy, or they may no longer suffer from cardiomyopathy or profound heart failure if they adopt a gluten-free diet. At this point, I would say it's criminal not to offer patients that option. If you had the opportunity to do a diet change versus to go on a heart transplant list, what would you choose? I'm pretty certain I would choose to go on a gluten-free diet if I thought it would help at all. So people really have to know that that is potentially an option for them. So this nice lady went back to her cardiologist and she said, I know you said I had cardiomyopathy and I changed my diet and I no longer have cardiomyopathy. My heart's normal. You would think that that doctor might actually research that a little bit. You would think that it might spur a skeptical or even a curious physician, cardiologist in this case, to research the literature in his or her own journals that might actually lead that physician to believe, again, this is not a religion, that a diet change or food is medicine approach might actually help their patients recover from something that we previously believed was not curable or fixable. Like I said, there's plenty of studies on PubMed in every journal across the world that actually addresses the impact that gluten or the gliadin protein has on the heart muscle and the vascular system. And I know I've said this before, but I'm going to say it again, and I may say it every time I do a podcast. In the emergency department, we never took a magnesium level on any of our cardiac patients. The CMP, or the complete metabolic panel, would include calcium as a level, but we never ever ran a magnesium level on people. Even though magnesium was available on all of our code carts as a potential treatment for things like torsades or eclampsia. Eclampsia being women that are pregnant and they're deficient in magnesium, so the potential is that they will seize. If you give them magnesium, that takes care of the seizures. The only treatment for eclampsia is delivery of the infant. I would say, I have to ask at this point, what causes the magnesium deficiency? And why are we not testing it for women that are pregnant or for people that are at risk for cardiac issues or the ones that actually show up in the emergency department with cardiac issues? Magnesium is a smooth muscle relaxer. It's also very important for cardiac health. If there's an imbalance between the magnesium and the calcium, or there's a deficiency in calcium or a deficiency in magnesium, it's extremely important that that is corrected because those deficiencies can cause arrhythmias. An arrhythmia is any irregular heartbeat. It can show up as PVCs, or premature ventricular contractions, PATs, premature atrial tachycardia, AFib, aflutter, and all types of other arrhythmias that can occur in the heart. Some people feel these irregular heartbeats and some people don't. If you have a calcium-magnesium imbalance and you're having arrhythmias or heart irregularities in the beating of your heart, then that can potentially be corrected. Of course, in the emergency department, we didn't actually correct those deficiencies. We gave people other medications. So we weren't actually treating the underlying issue or the underlying cause of the irregular heartbeats. And of course, if those irregular heartbeats get bad enough, such as in VTAC, or ventricular tachycardia, or VFib, ventricular fibrillation, those can be deadly arrhythmias, or they are deadly arrhythmias. It would behoove us as practitioners to actually start looking at the magnesium level. And when I say that, I am not saying the serum level of magnesium. It is most beneficial to find out what the magnesium level is in the red blood cells themselves. There's many studies that show that a magnesium level that is low can cause all types of healthcare-related issues, and many people are magnesium deficient. Of course, you can get magnesium through food. Pumpkin seeds are one of my favorite ways to get that. Also, interestingly enough, molasses, blackstrap molasses, organic, is another great way to get magnesium. So look into the food sources that you have available to you, wherever you are in the world, and try to eat as many high magnesium foods as you can. But then many of us also have to supplement with a source of magnesium. And if you're going to take a magnesium supplement, make sure that there is also some calcium in there and zinc and vitamin D. Very important for your cardiac health. At this point, I'm going to reference one of my colleagues' books. It's called Gluten Toxicity: The Mysterious Symptoms of Celiac Disease, Dermatitis Herpetiformis, and Non-Celiac Gluten Intolerance. This is a great book written by Shelley Stewart. She's also a nurse up in Canada. And I'd like to just read a paragraph from her book on nutrient deficiencies related to cardiac health. If intestinal damage is present, various nutrient deficiencies can occur, and this can cause or add to the severity of the cardiac and pulmonary symptoms, pulmonary being your lungs. Nutrient deficiencies that may affect the cardiac nervous system, cardiac muscle, and the functional structure of the heart and lungs include vitamins A, D, E, K, B complex, amino and fatty acids, calcium, magnesium, phosphorus, copper, electrolytes, iodine, iron, zinc, manganese, selenium, L-carnitine, antioxidants, and inositol. Thiamine deficiency is one example of how a nutrient deficiency can lead to heart symptoms. This deficiency can lead to the wet beriberi, like heart failure, or acute pernicious beriberi, low blood pressure, high cardiac output. Other examples of deficiencies include low electrolytes, or magnesium, calcium, leading to arrhythmias, low iron and B vitamins leading to anemia, which contributes to less oxygen in the blood, or low vitamin K levels, affecting protein S or protein C, involved in clotting, possibly leading to a heart attack. The presence of associated antiphospholipid syndrome could increase the risk of clots as well. Hypotension, which is low blood pressure, also a cardiac stressor, could result from low protein levels, such as albumin, low electrolytes, or dehydration, especially if diarrhea and vomiting is present. Overall, the few examples above help to demonstrate the variety of ways deficiencies can affect cardiac health. You can see how a delayed diagnosis could potentially be life-threatening. I couldn't have said it better myself. Shelley is very knowledgeable about so many things regarding celiac disease proper and non-celiac gluten sensitivity. Her book is amazing. Again, it's called Gluten Toxicity. I just had a discussion about cardiac issues and celiac disease with someone, and basically what they said was they didn't want to hear about celiac disease anymore related to anything, which I found very interesting. And of course, that makes me want to talk about celiac disease more, not less. Inevitably, I get told that people get tested for everything, in quotation marks, in the U.S. except for celiac disease. People go to the emergency departments and they get every test imaginable for their cardiac health. They get CT scans and MRIs and echocardiograms. But do they ever get tested for celiac disease? I can assure you that they don't. People get put in the hospitals for days Every test comes back negative because typically we do not test for the correct things. None of these people get nutritional panels. And I can assure you they don't get magnesium levels, especially not magnesium RBC levels. So are they really tested for everything? If they're not tested for celiac disease, then they are not tested for everything. That's one of the primary reasons I will not stop talking about celiac disease, because as a nurse, it's extremely important that we find these people that have undiagnosed celiac disease or it is negatively affecting their health. And by adopting a gluten-free diet, there's a good chance that their cardiac symptoms will resolve, whether it is arrhythmias such as AFib or aflutter, chest pain, difficulty breathing, or any of the other symptoms associated with heart attacks or strokes. Especially in women, it's very important that we actually identify people as soon as possible so they actually have the knowledge to potentially undo some of the damage that's been done. Our bodies do want to get better. It takes 6 months to a year to heal the intestinal lining for those villi to grow back. So it's very important that we start as soon as possible, as soon as people realize that gluten is impacting them negatively. One of the consequences of having villus atrophy is that we cannot absorb our nutrients appropriately. And if you can't absorb your nutrients, then your body has a hard time functioning. The other interesting component is that for a long time we've been told that fat is bad for us. Saturated fat causes heart disease and strokes. Nothing could be further from the truth. I myself am on a super good high-fat diet. My lipid panel is beautiful. It's neither low, which is not a good thing either, nor is it high. It's perfect. Actually, my nurse practitioner provider noted that my lipid panel looks like a 23-year-old marathon runner's lipid panel. I mean, I'm on a super good high-fat diet, and yet it does not correlate with a high cholesterol level or a bad lipid panel. As a matter of fact, my cardiac risk factor is very low. It's well within normal limits. So keeping in mind that heart attacks and strokes are caused by inflammation, not high cholesterol. But we do need to keep in mind that what causes the high cholesterol? Why are people malabsorbing fat and not able to absorb HDLs or the high-density lipoproteins? We need to make sure that people are able to absorb fat appropriately and utilize that fat in every cell in their body, and then also be able to absorb their fat-soluble vitamins, which are A, D, E, and K. So really what we're doing is we're healing the intestines, allowing for absorption of nutrients, healing inflammation, thereby providing our bodies with an intact immune system. All diseases start in the gut, as noted by Hippocrates a long time ago. So we really need to start paying attention to our intestines. We can't see them. So we need to use other markers as far as how healthy our intestines are. That is why it is so very, very important that we do a mass screening for celiac disease worldwide to find out what the true prevalence of celiac disease actually is. It's much higher than 1 out of 100, but we won't be able to actually prove that until a mass screening takes place, an appropriate mass screening utilizing appropriate testing. Just looking back at the study, the celiac disease linked to almost doubled risk of coronary artery disease, it's noted that this is an important study because it highlights a specific patient population who might be at higher risk for CAD, coronary artery disease, even in the absence of traditional cardiovascular risk factors. We were surprised by the strength of the association, especially in younger people. People and doctors should be aware of this association. Basically, what this is saying is that they were not expecting people in a younger age bracket to be experiencing cardiovascular disease. And these are people younger than 65. So these might be the people that are dying of sudden cardiac death, or more frequently, we're seeing people in the emergency departments that are having heart attacks and strokes, even people younger than 18. There's certain populations that are increased risk for heart disease, people such as people with Down syndrome or Turner syndrome or Williams syndrome. And this includes congestive heart failure, peripheral vascular disease, stroke, any type of vascular issue where your cardiovascular system is not working optimally. We all want to have a nice, healthy heart for as long as possible. And in order to do that, we have to find out how many people suffer from celiac disease but are undiagnosed. That should be our number one goal. If we're going to talk about preventative medicine, which I hear and read a lot about, then we absolutely have to talk about a gluten-free diet or a paleo lifestyle. And people must be tested for celiac disease, especially if they have idiopathic thrombocytopenia or idiopathic cardiovascular disease. Idiopathic basically means we don't know what causes these issues. But if celiac disease is the underlying cause, then we do know, but we have to test for it if we're ever going to find out. It's extremely important that people are aware of the fact that celiac disease is not just a gastrointestinal issue, that it affects every organ in the body, which is the heart and the neurological system. So celiac disease is a gastrointestinal issue, but it's also primarily a neurological issue. At this point, I'd like to thank everyone who has been listening to the Gluten Free RN podcast all over the world. It's a pleasure to know that people are getting information from this podcast that potentially will impact their health in a very positive way. I'd also like to thank Tim Hollowell of The Podcasting Guy for being such an excellent podcasting editor. And a huge shout out and thank you to the Pulse Media Network team of healthcare providers and professionals, also podcasters, who are extremely supportive of the Gluten Free RN podcast. Please refer to the podcast notes and refer other people to listen to the Gluten Free RN podcast also, if you think they might benefit from this information. If you really like this podcast, please feel free to leave a review and a comment on iTunes or Stitcher or Google Player. It really does help other people find the Gluten Free RN podcast. And again, let's spread the word. This has been episode 23 of the Gluten Free RN podcast. I'm Nadine Gruskowiak, RN, BSN, CEN, sharing all types of information about how gluten and grains impact our health and how we can potentially regain our health so that we can be the healthiest human beings we've ever been. As a 51-year-old woman, I'm happy to report that I am the healthiest I've been in my entire life, strictly by changing my diet. Not only am I healthy, I'm not dead. Every year is bonus, and I'm going to take huge advantage of the fact that I'm not dead and still alive. So join me as we investigate and report on the many ways that gluten and grains affect our health and how we can get our health back and advocate for ourselves and our family. Once again, thank you for joining me in episode 23 of the Gluten Free RN podcast. Keep in mind that every episode is released on Friday at 9 o'clock a.m. Pacific Standard Time. Until next time, this is Nadine Gruskowiak, Gluten Free RN, signing off.